As you know, I got involved in a very brief period of time when Atrium tried to take over UNC Healthcare. And let's be clear that whether it's the sellout of Wake Forest Baptist Hospital, which serves northwestern part of North Carolina, which would be hard for that community, that region of North Carolina to ever recover from that transaction, or any of these other transactions. The fact is that generally speaking, it's always about profits over patients and profits over employees. It's always about, getting your hands on a med school so you could possibly upcharge people for GME, which stands for graduate medical education. Or it's about, maybe in the UNC case, the ability of UNC Healthcare, I think this is still the case, to go in and garnish and recapture your sales tax refund from the state of North Carolina if you owe them money. So it's always about, at the end of the day, it's, in my opinion, it's about profits over patients. Any consolidation, Jason, that would be built on the chassis of patients over profits would be a good consolidation.
And then one that's just kind of unrelated to that previous one. Is your frustration today directed mostly at the hospitals themselves, the hospital executives, or mostly at Attorney General Stein, or all of the above and maybe even more?
Well, I mean, the Hospital Association and the Chamber of Commerce have filed not one but multiple lawsuits against both presidents of the United States in order to keep the executive order about hospital transparency from coming into effect. I'm paraphrasing, but in the third time they lost this in federal court, the Hospital Association statement went something like this, not exactly. We don't think telling people what things cost lead them to make better decisions. I mean, that violates everything that I understand about capitalism or economics, for example. And the reason I'm saying that is that anyone who continues to be in favor of secret pricing, secret executive contracts, weaponizing people's credit scores and breaking their kneecaps if they don't pay their bill, and the decisions that are made not to offer level of charity care equal to the billions of dollars of tax benefit they get. Anyone at any level of government who continues to be in favor of all of those or even one of those is going to be on the wrong side of history. Follow up, Jason?
No, thanks. That's it for me.
Okay. And Jason, let me add to that. What you sometimes, you see these hospitals talk about their concern about healthcare in rural North Carolina. We continue to work on some individual examples of exactly what they've done when they've gone into some of these rural communities. And you got to go there and actually talk to the people on the ground. And you realize that in many instances that they've turned these facilities into glorified emergency rooms so that they can either helicopter or ambulance everybody back to the mothership. Let me tell you why that should be concerning to you. I don't know of any EMS services in North Carolina that actually make money. Most of them are highly subsidized by the property taxpayers of their states, of their counties. So anytime that you actually shut down or turn your medical facility into a glorified emergency room, generally speaking, those people are having to be ambulanced back to the mothership. In many instances, the counties are not getting reimbursed for that. These are serious issues, especially in some of these counties that are depopulating and having difficulty in either recovering from A, their depopulation, B, the great financial crisis, C, COVID, and D, whatever's about to hit them next. So to go out and say that how much empathy you have or sympathy you have for rural healthcare when we are working on evidence that may point to the contrary is as disingenuous and as unfactual as everything I've ever seen them say or do. Follow up. Okay. Who's next? Joe, you have a question?
Hi, good morning, Secretary Paul. Well, yes, I do. My question is specifically in regard to the geographical area where I cover for the Charlotte Observer, and that is Lake Norman and the latest merger proposal here. The counter argument I've heard is that there is competition here. Atrium has plenty of a presence here, as does Iredell Health System, the Statesville-based Iredell Healthcare System. So we don't have universal health care in America. We have competition. Isn't this a question of competition?
Yes. And, you know, Novant has 15 hospitals, 800 provider locations. They've been hit in just last year with a 95-page federal report on problems that they have found in other places that they have taken over, which I'd recommend that you look at. Specifically New Hanover Regional, which goes back to Johanna's question. And they nearly lost their Medicare contract over significant deficiencies found after the healthcare giant purchased New Hanover Regional in 2021. So whether it's competition or not competition, I just go back to what Maya Angelou, who was a former neighbor of mine, always said. When a person shows you who they are the first time, you should believe them. And these are federal reports that are already in the queue and evidence of how Novant operates. And Joe, I just want to say, we're having our medical debt de-weaponization forum in Charlotte on March 16th at 2:00. I want to remind you of that. And I also want to remind you that in addition to being the state treasurer in North Carolina, this all started with me over a decade ago when I read the Charlotte and the News and Observer's Pulitzer nominated piece called Profits, Prognosis Profits. And if you take that Pulitzer nominated piece, Prognosis Profits, and you look at what you and others reported on 10 years ago, Joe, everything has gotten not mathematically worse, not geometrically worse, but exponentially worse in the terms of how much healthcare costs in this state.
Could I ask one quick follow-up question?
Yeah.
In regards to this latest merger proposal, is there anything specifically that you would do or consider doing at this point?
Well, I'm in favor of high quality, high access, profitable, independent hospitals is what I'm in favor of. But when we have these entities that have basically turned into real estate development, investment banking firms, and I'm sure you've looked at the property reports for Atrium, for example, about the property they own. There's pure evidence when you look at that these multi-billion-dollar corporations who disguise themselves as nonprofits, there's pure evidence that they have really just turned into investment banking and real estate development firms. Yep. Huh? Joe, got anything else? Is that it, Joe?
Thank you.
Thank you, Joe.
Thank you.
Thanks for joining us, and I hope you can join us on March 16th at 2:00.
Thank you. I'm writing it down.
At the community college?
Yes, thank you.
Yeah. And we've got some good panelists that are going to be on there. Commissioner Pat Cotham, Reverend Doctor, he's got more degrees than a thermometer, Woods from First Baptist of Charlotte, John Annarella, and maybe even Representative Bradford. Nobody's ever accused me of having more degrees than a thermometer, so when somebody has them, I just want to point it out. Teresa, you have a question? Thank you, Joe.
Thank you.
Yeah, unrelated to everything you've talked about this morning, what are your thoughts about the deal reached for Medicaid expansion in the legislature? What was included, not included, just in general, what your thoughts are?
Well, number one, we haven't seen the legislation. Number two, I've continually said for a long period of time that the decision to expand Medicaid in North Carolina is been a battle between the General Assembly and the governor. The reason why this topic is so hot right now is that the Biden administration put carrots and sticks into Medicaid expansion that has caused the leaders of the General Assembly to take a second look at this topic after being adamantly against it for over a decade. My well, what I know is this. We don't have a revenue problem with healthcare in North Carolina. We have a cost problem. And that's not just me saying it. That's very reputable think tanks from across this country and across the world who are saying this, like the U.S. Institute of Medicine. So I don't know how you actually try to fix an issue with a revenue solution when the problem is actually the cost of healthcare. And secondly, we have not seen the bill. I'm very concerned that this will be another unfunded mandate on the state employees of North Carolina. We have been able to freeze family premiums for 5 years. We've cut over $100 million of administrative expenses out of the state health plan. We've renegotiated our Medicare Advantage contract to save $1 billion, no cost to the member and no cost to the taxpayers. We've saved over $800 million with our pharmacy benefit management contract. We are changing the transmission in our state health plan for the 550,000 active employees or people who are not yet 65. We've done everything that we possibly can. But until we get reference-based pricing in the state health plan, nothing's going to change in terms of the cost. So I hope that before it reaches its final destination, that the General Assembly will put reference-based pricing in the state health plan, starting at 100% profit for these nonprofits off of Medicare reimbursement rates. Our reports recently show that, these hospitals make money on Medicare. And I just want to remind you as elegantly as I can that every time that we put out one of these reports, I've talked to many of you on the phone and have talked to many of you privately. Not one of you has ever been able to get the hospital association on a telephone call or on a Zoom call or in a public meeting. Every dealing that you have with the hospital cartel is through an email or some kind of statement. The fact is that this type of secrecy is what I'm referring to as putting us on the wrong side of history. So, Teresa, once we see the bill, we want to be absolutely we don't think there's going to be an unfunded healthcare liability on the state health plan, but we want to know. It's been my hunch, and I have not backed off this because nobody has proved me wrong, that the members of the state health plan, those that teach, protect, and serve, have very possibly been cross-subsidizing other things that go on in these medical facilities because the state health plan has been considered the gold standard for decades for healthcare. And that's one thing that this transparency would allow us to have a look-see into. But we have already sent the General Assembly a letter asking for $4 billion more dollars over the next several years just to keep the state health plan solvent. And we don't need anything in Medicaid expansion that's going to exacerbate that. And oh, by the way, freezing family premiums is not enough. We need to lower family premiums. And I also say this as elegantly as I can. We need young, healthy families in this state health plan to offset people my age. I mean, it's a self-funded insurance company. You can't have just people my age in this insurance company. You got to have young, healthy families in this plan to offset people my age. And the only way we're going to be able to do that is not by freezing family premiums, not by freezing the deductibles and copays, which we've already done. The only way you're going to accomplish that is by lowering family premiums. We have teachers and troopers and corrections officers and others that teach, protect, and serve who are having to work 1 week out of every 4 this year to pay the family premium. 1 week out of every 4. So that's the decision between housing and health insurance, food and health insurance, energy and health insurance, living their life and health insurance. That's why this is so important to me. We have been able to take advantage of our largeness with our Medicare Advantage contract, with our relationship with Humana. We've been able to take advantage of our largeness with our PBM prescription drug contract. We have not been able to take advantage of our largeness regarding the greatest portion of our population that's in the state health plan.
Okay, great. Thank you. That's all I had. Thanks so much.
Any other questions?
This is Jason again. If I could maybe piggyback off that, as it relates specifically to changes to certificate of need, I wonder if you've done some more thinking on those. I'm thinking specifically of the change where it now should open up more competition for practices or hospitals or really any medical entity to open surgery centers in urban counties. So these would be the places that could do orthopedic surgeries, which are pretty high margin, generally speaking, for the big health systems. There's some thinking that by opening those up or stripping those away from certificate of need, that it will increase competition. Increased competition could lower prices. I'm not saying that will or won't happen. I'm wondering if that's something you've looked at, and if that's an area where, do you think that would lower costs potentially, or for patients in at least in those areas? And then sort of a piggyback question off that, would you have liked to see more medical services stripped away from certificate of need as part of this Medicaid deal?
Well, yes, certificate of need, no matter if you're from the East and you pronounce it character, or you're from the West and you pronounce it character. The first 3 letters of those 3 words are pronounced con. Certificate of need is a con on the people of this state. We're only one of 13 states that has a AAA bond rating, and I believe we're only 13 states that has a con. So any adjustment of certificate of need in this Medicaid expansion needs to involve a full repeal of certificate of need, and it doesn't need to have an effective date 4 years from now. And I also want to remind people, when we talk about the solvency of the state health plan and lowering family premiums, our own Julie Havlick and other reporters at the Carolina Journal reported several years ago that certificate of need laws are costing our state health plan $250 million a year. Do you know what we could do with family premiums for $250 million a year? Even if a portion of that savings from completely repealing the certificate of need law were to go toward that, we would make a significant difference, which would put those that teach, protect, and serve in a position to actually inform and ensure their young, healthy families. And by the way, we're already the 10th most expensive state in the United States for outpatient care. Follow up?
Just on surgery centers specifically, from your answer, I'm going to assume that you're happy that they're stripped out of certificate of need, though that it's not enough. But if you could maybe address those, that little subset specifically, again, surgery centers no longer being required certificate of need service in urban counties.
Yeah, I would. It's not fair to you and or to my staff for me to comment on something where I'm not up to speed as much as I should be, like on the nuance of that question, which is a very, not just an important question, but a valuable question. And I'd like the opportunity to get back with you about that about the end of the day.
No problem. That's perfect. Thanks.
Yeah. Chip? Chip, do you have a question from
Yeah,
pensions
good
and investment?
Yeah, good morning, Treasurer. I've noticed, I'm turning to the bond angle. I noticed that Senate Bill 99 has been filed. It's supposed to increase the transparency on bond referendums. Could you talk a little bit about that?
Yeah, thank you. This is something that I've been in favor of since I was in the General Assembly. There are a couple of things going on here, Chip, and I'll try to make this quick. Number one is that when you, Chip, apply for a credit card, buy a house, or do any kind of transaction in the banking or credit world, there's all these pages of disclosure, right?
Yes, sir.
But all we really do when we ask the voters to increase the credit limit on their credit card of their communities, all we put is about 25 words on a ballot. I've long been in favor of full disclosure, of telling people who are going to be paying these increased property taxes based on this issuance of these bonds, that they know what the estimated interest cost and the present value of all that is. So just to be as transparent about the disclosure on that as we are on everything else that we deal with in terms of a credit card or buying a house. The second piece of this, which I'm not sure you're asking about, but one of my 20 hats that I wear is I chair the local government commission. And we are also trying to put things back to have clarity of thought and put things in the right sequence. For example, Guilford County, Chip, which is one of the fourth largest county in North Carolina, Greensboro area, and High Point. Guilford County voters on the same day, on the same ballot, approved a $1.7 billion school bond, but disapproved the funding of it on the same ballot on the same day. One passed 60-40 and one failed 60-40. And then on top of that, sometimes they have been coming to the local government commission, the commission I chair, to get approval to issue bonds. And then they would use our approval to quote issue bonds and go back to the voters and say the LGC approved this. We are getting that sequence all straightened out to where we are going to be approving bonds at the local government commission after the voters approve general obligation bonds. Those are two things. Follow up?
Yeah, I see that the Mecklenburg School District is looking to have a giant $3 billion sale. And so I guess that will be something that you'll be taking up eventually.
That's right. And part of this, and Chip, we're glad you're joining us, but part of this, especially for the North Carolina-based people, is that, especially in rural North Carolina, we need to make sure that the lottery, the 40% of the lottery proceeds, which has doubled in its profitability, doubled, that 40% of the lottery proceeds, as originally intended when the lottery was passed, I was on the floor of the House the day it passed, that 40% of the lottery proceeds, now that the profit has doubled, is going to public school construction. More importantly, and as importantly, that school districts can use this not just to replace buildings, but actually replenish buildings. We have a lot of great schools in North Carolina. Some of them are twice as, or much older than I am, that have good bones. And some of them just need new legs and arms and HVAC systems and plumbing systems. A lot of great buildings. The one I'm thinking of is Old Town Elementary there in Winston-Salem up the street from Wake Forest University, where as a school board member, they were going to tear down the whole school. And then I came in and said, well, does the core of this school have good bones? And they said it does. And I said, let's tear off the legs and the arms and put new legs and arms on it. And you can pull it up on the website. What a beautiful elementary campus that is. My point of saying that to you is that if we're doing everything that we're supposed to be doing, as far as 40% of the lottery going toward public school construction, and that money being able to use to replenish and in addition to and or replacing buildings, then there may not be as much need for school bonds going forward.
Thank you very much, Treasurer.
Thank you. Dave? Dave Middleburg.
Hey, good morning.
Hey,
Follow up, when you were asked about Medicaid expansion, every other politician talks about 500,000 people getting insurance policies that the rest of us already have. You went to cost control. Are there legislators who are, really pushing for cost control that we can follow up with on this?
well, we have a few legislators that are focusing on cost control, but one thing, going back to the premise of your question, Dave, when 500,000 people don't have something, that means they can't afford it, right?
Right.
That's a cost problem. When you can't afford something, it's a cost problem. And I think that my belief is that we're spending enough billions of dollars on healthcare in North Carolina. We have become one of the most expensive healthcare states in the United States, that if we did more focus on the cost of healthcare, lowering the cost of healthcare, and it's even more deeper than that for me, Dave. We're now in a situation where people are afraid to consume healthcare and can't see themselves past their poverty even when they do consume healthcare, because they don't consume it, it consumes them. So we're in a very bad vortex here. And I think that my accounting background is that when you try to solve a cost issue with a revenue answer, that at the end of the day, you don't get the desired results. And to go back to the other premise of your question, Dave, I'm concerned about the state employees that teach, protect, and serve who aren't insured. We have a great number of people who are not insuring their spouses and their dependents, because the individual premium for the state health plan is $25 a month. The family premium is $600 to $700 a month. That goes back to the working 1 week out of 4. So my big concern about all this is, how can we, when you talk about people not having insurance, how can we make sure that all of those that are teaching and protecting and serving on all of our behalves this morning can afford the family premium on the state health plan? That's the uninsured people that I'm most concerned about, and that I have responsibility for. But great question. Thank you.
Well, thank you. I just one other quick follow-up. Joel's question about the Iredell County situation. I mean, if there's not enough competition there, it would really seem like you would not be positive towards any consolidation, right? Because, like you said, you got 3 competitors in that market in a relatively small area. So, I mean, that is very different than like a lot of other places across the state where it's more of a monopoly, right?
Yeah. As I'll repeat what I said to Joe, that I'm in favor of any consolidation that actually increases the quality, increases the access, and lowers the cost of healthcare, period. And I've not seen one of those yet. Follow up? Any other questions? Well, thank you for joining us for a robust conversation. Chip and others from out of state, thank you for joining in. We're accessible if you have any questions about anything that's going on at the Treasurer's Office. We have a local government commission meeting this afternoon. The Council of State this morning was canceled. There's sometimes news that come out of the Council of State meeting. The local government commission calendar is not as deep as it normally is. And this is the March meeting, obviously. In April, we're going to be meeting in Wilmington. The local government commission has never really met outside of Raleigh. Last year, we went to Columbia, North Carolina, Terrell County, one of the lowest income counties in the United States, and then Western Carolina. And then this year, we're crisscrossing with Wilmington and Appalachian State. We're doing this for a couple reasons. Number one, to bring Raleigh to these communities. But number two, hopefully to attract, either through the community colleges or the universities, some MPA and other types of public policy types of undergrad, to show them the virtue and the importance of being public servants. So we're very appreciative of the hospitality in Wilmington, North Carolina, and the hospitality that we're going to also have in Boone, North Carolina. So this afternoon is the Local Government Commission. Lots of issues on there. Next month, the Local Government Commission will be meeting in Wilmington, North Carolina. And well, I'll be doing this somehow. Either I'll be doing this and then driving to Wilmington, or be doing it from there. I haven't quite figured that out yet. But we appreciate all your interest in these topics. Have a great week.